We have been acknowledging American Heart Month all month in February.
That's right. SouthCoast Health Cardiologist Dr. Akinniran Abisogun will have a special Facebook Live presentation on heart health next Wednesday. He joins us now with the preview.
Hey, good morning. How are you?
Hi.
Thank you for having me.
This is a great way to get information out to a lot of people at once.
Right, it is. It's really important to be very aware of your heart and the different risk factors that can lead to bad events like heart attacks and stroke.
So what types of questions are you expecting? You just kind of ask anything?
Yeah, anything that is of concern. So a lot of people wonder, how do I know that I might be having a heart attack? How do I know that my heart isn't functioning properly? Any question that you're concerned about, you can ask. It's a kind of a judgment-free zone, and you could just sort of spout those out.
So you're going to start around noon next Wednesday.
Yes.
Go for an hour or so, and
Absolutely.
it's on Facebook, so it's a live event. Folks can just sign up. How do they get to you?
So the easiest way is to go onto the SouthCoast website. You can go onto our Facebook page, and there will be a link there. There'll be a link there, and then you sign on to the Facebook page, and then you can just sort of submit your questions to us.
What are some of the biggest questions you get usually from your patients that you see every day? How
do I prevent having a heart attack?
Yeah.
And that's a really good question, and there's a lot of ways to do this. Number one, diet. You have to decrease cholesterol intake. You have to exercise as much as you can. You should know your numbers. So it's very important to try to keep your blood pressure under control, know what your blood pressure is, keep it under that 130/80, know what your cholesterol is, keep that as low as possible. Those are the easiest way to do it. And probably most importantly, avoid things like smoking, because smoking can really increase your risk of a heart attack.
Yeah, it's a really good point about the numbers, because I have to confess, I'll have an annual checkup and they'll tell me the blood pressure numbers. I have no idea.
Yeah, I couldn't tell you what mine is right now.
That's right.
They say, oh, they're good, they're this and this over this, but I don't know what they're supposed to be.
That's right, that's right. And it's kind of a language, because we know our shoe size, we know our height.
Weight.
And we know our weight.
Yeah.
We should know what our cholesterol is, we should know what our blood pressure is, and just having that knowledge is power, and it helps you sort of tailor your care and take control of it.
And then at what point, when you think you're starting to have some symptoms, do you go to maybe your regular doctor? What time do you go to the emergency room?
Yeah.
So it depends on the symptoms. If you're ever having chest pain, you should take that very, very seriously. And you should call your doctor, and likely you need to go into the emergency room. But there's less apparent ways that your heart could be having trouble. Some people have pain in their arm. And a lot of women, often they have nausea, belly pain, generalized fatigue. Those can all be coming from your heart, and you should seek medical attention.
Because it's always better to be safe than sorry. I mean,
absolutely.
You doctors are used to getting those types of calls.
Absolutely, absolutely. If you're ever concerned, just call us. We're here to help.
And then if you are having an annual checkup, what might you tell your doctor that, hey, I noticed this is a little bit different, that could lead them down the path of, now you need to go have this checked out?
Right. So if all of a sudden you have a lot of shortness of breath, if you have swelling in your feet, if you can't exercise as much as you used to, let's say you don't exercise and mowing the lawn or doing house chores has become really arduous, it's become really difficult, and you get short of breath with that. Those are all reasons that doctors, we become concerned. So if people tell us things that make it seem that they can't do what they used to do, those are very concerning findings.
Fantastic. So again, your Facebook Live event next week is one of the ways that South Coast is helping spread awareness during American Heart Month.
Yes, yes. So hopefully we get a lot of people that come in and just ask us questions. And one thing I want to mention too is, if dental health is also very important. And there's a clear link. We heard about cats' teeth.
Sure, yeah.
But human teeth are important too, and there's a link between poor dental health and heart attacks and strokes. So just doing all you can from all facets can help your heart health.
Fantastic. Doctor, thank you so much.
Yeah, thanks.
It's a pleasure. It's a pleasure.